and is currently a faculty at St. Louis University of Medicine. In addition to teaching and research, he runs a special clinic of patients with pulmonary hypertension and rare disease and rare lung disease. Dr. Mwangi has been serving in the Veterinary for Africa board since 2015. He is also a volunteer with the V4A to promote health education to immigrants and mentoring the youth. Next, we have Dr. Nihal. Dr. Nihal graduated from St. Louis University and resettled in the United States. Dr. Nihal, other research interests include chronic diseases, maternal and child health, infection diseases, clean water issue in rural areas and sanitation in urban areas, global health issue, data collection, and management and environmental health. Dr. Nihal currently works at St. Louis County Department of Public Health as manager of chronic disease epidemiology program, where he oversees surveillance of chronic diseases, including mental health in the country. In addition to his responsibility as manager of the chronic disease epidemiology program, he is the project director of Project Restore, a $1.5 million project funded by the Office of Minority Health of U.S. Department of Health and Human Services to implement intervention to reduce risk factors for violence among minority youths. He is also the project manager of pilot project funded by the Council of States and Territorial Epidemiologists, which is also known as CSTE, to establish surveillance of naloxone use in St. Louis. In addition, he is the author and co-author of numerous peer-reviewed papers. He is also the author of a biography about his late father, Liberating South Sudan, One Patient at a Time, The Life of Dr. Timothy Tutlam. And next, but not last but not least, we have Dr. Melissa. Dr. Melissa Focus Impacts Fellowship, St. Louis, Missouri, 2018-2019. She's currently the Vice President and Chief Medical Officer of Athena Health Care. Okay, so ladies and gentlemen, that is for our panelists. For the first question we have is for Ms. Rebecca. Ms. Rebecca, could you please share with us about the flu vaccine, the importance and common misconception, and how we plan to provide COVID vaccine?
Okay. Hi, can you hear me?
Yes.
Yeah, I'm so sorry my video is not working since happened. The flu, as we all know, is a potential serious disease that can lead to hospitalization, as well as it can threaten our lives, which means it could actually potentially kill people, which it does from year to year. A flu vaccine is considered one of the best ways to fight the flu. Vaccines train our immune systems to create antibodies that weakens the virus and decreases its complications. Flu vaccines are important as it keeps people from getting sick with the flu. It also reduces hospitalization associated with the flu. Flu vaccines, just like any other vaccines, are life savings for children, pregnant women, older population with comorbidities and chronic health conditions. Vaccinated people can also protect other people around them. The immigrant community has different misconceptions about taking vaccines, and one among them is overload immune system. They think by getting the flu, you're just making your immune system overload, which they don't think it's necessary. And also the fact that they don't really see the disease They think the disease, there is no such disease. I mean, a good example would be the polio. We don't see polio, so we don't really know the importance of the polio. Likewise, if they don't get the flu, they don't really think there is anything going on. So they just don't think it's important to protect themselves against it. Sadly, until usually they get infected with the flu, at that point, it may be too late for some people. And then people also are concerned with the possible harmful side effects or illnesses and death, which they think could arise from getting the flu vaccines. Another common misconception our immigrant community have is they think improved hygiene and nutrition are better substitutes for vaccinations. It's true, we need to get, the more better your immunity is, the better you are against viruses like the flu, but then getting vaccinated has a more advantage over just having a good immune system or having a good hygiene system. They all work hand in hand. One is not typically way better than the other. And so basically, those are some of the normal misconceptions we have about the flu vaccines. And actually, most of us also get to places like the US when we're much older. So we just can't grasp it that we find ourselves in a community whereby every year something happens that you actually have to get a vaccine against. Back home, we only get it once for the childhood, vaccinations, that's about it, and then you're done. So the fact that every year you have to be vaccinated against something, it's kind of not a very easy sell to most people because there's no point in that. So then that's why they always reverse to, if you eat better, if you do your regular protective mechanisms, you're better off than getting the vaccine. But I mean, as has been proved over and over again, when you get vaccinated, should you get the flu, your chances of doing better is between 40 and 60%. So you are of a higher advantage when you get the flu vaccines versus if you don't get it. So we need to continue to educate our people to know that it's very important for us to be taking those preventive measures. It's a preventive measure in addition to good hygiene and making sure we have good immune systems. So they all work hand in hand. I mean, if you do the good hygiene and you have good immune system, kudos to you, that's really very good. But then if you add the third option, which is getting vaccinated, I mean, you can just imagine the advantages you have as an individual versus somebody who is not doing any of them at all, or just doing one or the other. So that's just a point I would like to emphasize this evening. And a good case in point is this year in particular, we had a lot of people who got the flu vaccine than any other year. We have a lot of first timers. And guess what? This year, despite everything else going on, the flu vaccine is it's minimal. There are pharmacy upon pharmacies who have not dispensed any antibiotic or any of the regular flu medications that we have. So it kind of shows again the importance of getting vaccinated. We have a lot of people who showed up and took the vaccine and the effect is the flu. I mean, you can test for the flu. Very, very few people. I don't even think the percentage is up to 5% that is coming back positive with the flu vaccine. So again, vaccines do work. They work. So we have to keep on taking them anytime we get the chance to do that. When it comes to the COVID vaccine, from pharmacy standpoint, we have currently two types of COVID vaccines. We have the Pfizer vaccines and then the Moderna vaccine. The two are not interchangeable. They are two different vaccines. So when you get one, make sure when you go back in for your second dose, you're getting that same thing you got the first time because they are not interchangeable. That's the first thing. And they both have to be given twice. You need your first dose and the second dose. If you get the Pfizer vaccine, you have between 17 and 21 days, let's say 3 weeks to get your second dose. If for some reason you don't make it, don't panic. Just go as soon as you can to get your second dose. With the Moderna vaccine, there's an extra 1 week. It's between 24 to 28 weeks that you have to get your second dose. So those are the two major differences. And then always remember, there are two different vaccines, so stick to it. That whatever you get the first time, that's what you're supposed to get the second time. And also remember that regardless of what you get, either the Moderna or the Pfizer vaccine, it takes up to 2 weeks to be effective in your system. So the mere fact that you get the vaccine today does not mean your body is ready to recognize that virus if you get infected. So remember, it takes 2 weeks. So likewise, if you get the vaccine and you ended up testing positive, first of all, the vaccine is not live. It cannot cause your disease. And that also goes to prove that that is not the cost of whatever illness you may have right away. And so in the pharmacy, of course, just looking at the drug side of it, the vaccine, like I said, takes 2 weeks. And the other important thing I can talk about as a pharmacist is the side effects. Yes, there are some side effects with the vaccine. The most common being the injection site. Your arm will swell up a little bit. There could be fatigue, headache, muscle pain. There will be chills. There could be joint pain, fever, nausea. And then in some rare cases, you have lymph node swellings and other anaphylactic reactions like maybe you break into hives, which is one of the common ones, or you have a breathing problem, you start to have a wheeze or you're coughing really bad. So from the pharmacy standpoint with the COVID vaccine, be prepared. When you come in and we inject you with the COVID vaccine, be prepared to spend at least 15 minutes with us. We have to observe you for 15 minutes and make sure you're okay before you go. If for some reason you know to have any kind of allergies going on, you react to other vaccinations in the past, then you have to be prepared to stay for at least half hour for us to observe you and make sure you are okay before we send you out on your way. So those are the very important things that you have to consider when you come in for the COVID vaccine. And the other important thing, again, which is a little bit different from the flu vaccine, is with the COVID vaccine, there is a card that you receive. That card will show that you receive your first dose, and there's a place which will be marked for you, or a date that you have to come in for your second dose. So make sure you get that card and make sure you keep it well. And then there's the other different thing is there's something called vSafe. And what vSafe is, it's a CDC website that is, it's going to help CDC to know how people are doing with the vaccine. So when you go in for your COVID vaccine, make sure you get that paper, which has a website on it. That website, you can just use your smartphone, take a picture of it, and it will lead you right there. You can go in, you register yourself, the type of vaccine you received, either the Moderna or the Pfizer vaccine. You can actually document whatever you received in there, and then you get monitored. So if you do your registration before 2 p.m., there's going to be a text message once your registration goes through, and then they'll be checking on you. So depending on the kind of answers you provide when you go in and then answer the questions that we ask, a CDC person may or may not contact you. So if you seem to be having some kind of a reaction going on, they may follow up with a phone call with you. But it's very important we do that too, because this vaccine is new, as we all know it. And every data collected is very important moving forward. So please look out for those things. Make sure you get your small card, which shows you've been vaccinated the first time. And also make sure you download the vSafe website. Go in there, register yourself and put in the information that is needed. And from the first question that was asked, yes, I mean, it hasn't come to our level yet. We don't have the vaccine. I just got several calls today because they can find my pharmacy on the vaccine finder. So they are calling like, when do you have the vaccine? I don't have it yet in St. Louis. Yes, there are plans ahead. I could get it. We could get it from two sources, from the county or from our wholesalers. And all of them are working as quickly as they can to get it to our level. The emails are coming in over and over again. So we know we're getting close. We're getting very, very close. So sooner than later, maybe in a week or two, it will come to our level. And then we'll go through the criteria which the state will determine, and we'll start going from there. So it is coming, and it's be here sooner than later, but these are the few points that I have. So thank you all for your time and listening to me.
Thank you very much, Ms. Rebecca, for that. Next, this question is for Dr. Nihal. Dr. Nihal, could you please talk about the current COVID-19 statistics and any updates on vaccine from St. Louis County?
Sure. Thank you, everyone. I'm glad to be together with this great group of people to talk about COVID-19. I have some slides that I prepared just for that. So let me share my screen so that I can do this. Just bear with me a second. Can everybody see my screen now?
Yes.
Okay, good. All right, let me do this. All right, so thank you again for that question. So, and I'm glad that Ms. Rebecca went first. I think she set the table very nicely. I'll provide some updates in terms of where the county is with the vaccines, as well as just give you some statistics in terms of how we are doing. Before I get to us locally in St. Louis, just want to give you a brief happening in the country. So you can see this is data from the COVID Act Now group, and this is data across the country. As you can see, the dark red ones, they've categorized, that the levels of the outbreak or COVID-19 into five different categories. The dark red one is obviously the more severe one. The bright red one is the active disease outbreak. As you can see, the entire country is basically either dark red or bright red, and that meaning that we are all doing really, really terribly right now, except for North Dakota, which seems to be coming out of their worst over the last 2 months, and so they seem to be getting in that, not really out of the woods yet. They're still in the at-risk group, but you can see it's the only place that is orange right now. In terms of the global picture, so 93 million people have been diagnosed with COVID-19. Just today, we crossed 2 million people deaths in the entire globe. And obviously the picture is much worse. The United States is also the epicenter of this outbreak right now, the pandemic, with almost 25% of the world's cases, 23 million, almost 24 million, and then almost 390 million people who have died as of today. Just think about it. By this time next week, we will have crossed 400,000 people. And that's just terrible thing to do. So as I said, I'm going to give you some national figures. This is data from the COVID tracking project. You can see just yesterday, about 222,000 people in a single day. So we are recording almost 1 million cases in about 4 or 5 days right now, with about 28,000 people hospitalized as of last night. And we are recording about 4,000 deaths across the United States, almost on a daily basis. That's why I'm saying by this time next week, we will have crossed that 400,000 mark. Grim, really grim.
My hands.
This is just the numbers going weekly by week, week by week. So you can see the number I want to draw your attention to is this, the new cases. So if you heard over, the holiday season, people were advised not to travel, to stay home. You can see the effect of what happened during that holiday season is what we're beginning to see now. So week to week, you see Just from last week, we've gone up in terms of new cases, about 11%. In terms of deaths, just from last week, we went about another 25%. That is also going in the wrong direction. As you can see from here, you can see that dark line over there in terms of the deaths. It's just going up and up, and it seems to be slowing down. This is really a number that gives me, that scares me, terrifies me. So you can see this is data from the health metrics and evaluation projection by April 1st that, we will lose about 567,000 people. Think about it. We are at 389,000 right now. Just another couple of months, closer to 600,000. That is a terrible number. In terms of St. Louis County, so this is data from St. Louis County from the beginning of the pandemic, March 7th, which is when we recorded our first case here. We've had 77,000 cases at this point, so we've gone up and down. The last couple of months, we've really had a terrible time with it, with really high number of cases on a daily basis. Right now, we are recording up to about 533 cases on a daily basis. Seems to have tickled down in the last couple of weeks, but we are still in that really terrible place where even contact tracing and all that and case investigations is really difficult just because of the volume of the people that are coming through. This graph here just shows you the number of people that are dying on a daily basis. You can see there it was really terrible in the spring, late spring, and then sort of slow down over the summer, and then we've gone up again, as you can see there. Really, thus far we've lost, unfortunately, about 1,500 people. Just for context, I told you that we St. Louis County alone, so we are a population of about 1 million people, and we have about 77,000 cases. Australia in the entire pandemic recorded close to about 30,000. And with about less than 1,000 people dead in the entire country. And so you can see the response in terms of how other countries have done compared to just us. St. Louis County, a small kind of 1 out of 3,000 counties. You can see what is really the United States really has been terrible at this. You've seen from the news coverage that there are these disparities. Those of us in public health always know that there are health disparities, and Dr. Melissa will probably talk about that. That's where she works. And you can see just in St. Louis County here, we've also seen similar trends in terms of the mortality rates. So African Americans obviously have a higher mortality rate compared to the rest of the population. And you can see also the graph on the right-hand side here. Older people have been affected the most, and so you can see that data we have here confirms that as well. This is data looking at new cases by zip code. So we took just 1 week worth of data. So this is from the 29th of December to 4th of January this year. You can see right now it's shown that the highest rates are sort of in the southern part of St. Louis County. You see hospitalization, these dark red, the red orange lines there. Zip codes tend to be that's where we have highest rates of hospitalization. We at least as of this week we were seeing highest rates of new cases here. But let that not fool you. If we were to map out the entire pandemic, most of the cases actually, it would be the highest rates will be in the northern portion of the county here for obvious reasons that we know. This is you obviously more economically deprived areas. I do chronic diseases. I can map diabetes, heart disease, and all this. And the cases will be highest the rates will be highest in North County, as you all know. So now let's talk about vaccines. So Rebecca talked about vaccines earlier on. So vaccines are actually, this is the responsibility of the state. So the state makes the decisions and makes the determinations of who gets vaccinated at what time. So this is like the rollout of the vaccines for the state. This is up to date. This was actually a document from today. As you can see, so right now we are in phase 1A vaccination. That means that only healthcare workers, people who are working in healthcare, long-term care, hospitals, and all these are the people who are in 1A that are being vaccinated. just yesterday, the state activated 1B tier 1. So 1B has three tiers. So they've actually activated tier 1, and actually we are expecting some new doses sometime next week. I think by Tuesday, the county will receive new doses, and we are right now vaccinating all of these people who are in 1A. And then as we move through those, we will move to people in that next tier 1B tier 1. We'll start vaccinating them, and I'll show you some links where you can sign up to sign up for the vaccination. And obviously there will be phase 2 vaccination. So people, basically the remaining people in these different categories will be vaccinated. Crucially here, people in higher education, faculty members and all that fall under this category. And then in phase 3 here, basically all those that have not been vaccinated, anybody in the state of Missouri that wants to be vaccinated then can be vaccinated in that. And I'll share with you the website of the county, and both the website and the state website, where you can go, and there is a detailed list of all of these people so that you can look at the list and see where you might fall in this sort of rollout strategy. So like I said, right now, the county is actually checking free registration of people. If you want to check the vaccine, you can go to this website here, and I'll put it in the chat box there. You can go to this website and pre-register so that when your time comes, the county will send you an email so that you can schedule an appointment, and you will be scheduled to come receive your vaccine. The city also is doing the same thing. You can access that if you live in the city. You can access that link, and you can pre-register just so that at least you are in line there to be vaccinated when your time comes. Also for people who are older, so we are at the age of 60, and we know that some people don't have access to the internet and all that. So if you do not have access to the internet, we are partnering with the Department of Human Services. So we are part of the same government. So their county older resident program is actually helping us to sign up people over the age of 60 who don't have access to the internet. And so you can just call the county here, and they'll take your information, and this county older resident program will call you back and actually pre-register you so that when your time comes, you can schedule your appointment and receive your vaccine. Now, one thing I just want to touch on, and I'm glad that Rebecca touched on this earlier on. So there are a lot of misconceptions right out there, right? So that the vaccines, were rushed, that, therefore they are not safe, that, you can get COVID-19 from the vaccine. She accurately said, this is actually not the live virus, so you cannot get COVID-19 from this vaccine. And then people are saying, well, these vaccines, now they're trying to experiment on Black people. And then on the other hand, some people also say, well, we haven't had enough trials on Black people and all that. That also, this can change your DNA. All of that information is just misconception. It's not based in reality. So this doesn't change your DNA. Actually, the vaccine is only, Dr. Mwangi may talk about this later on. It's just the spikes of the virus that that mimics the virus itself that is injected into you, so that your body can be trained to identify by the vaccine. Some people also say the vaccine causes infertility. There is no evidence about that at all. And then obviously, people say you already have had COVID-19, you don't need to get vaccinated. That's not necessarily true. Right now, I think there are some that are recommended that you wait 90 days before you get your next vaccine, and so you can do that. And I mean, I think we have to talk about this. That's why people like us need to get in front of people. There is a legitimate reason why some people may be hesitant because of it to take the vaccines, because of the history that we know. You can talk about Tuskegee, you can talk about all these other things that have happened in the past, and we need to confront those and talk about those and address those concerns. Now, this vaccine is not that, and that is based in reality. There was a survey done by the Kaiser Family Foundation and Undefeated, and they found that up to about 50% of African Americans say that they are not going to take the vaccine, even if scientists say this is a safe and effective vaccine. So you can see that we have a lot of work to do. We have to educate our community members that this vaccine is safe and it's safe to take, and so we need to be doing that. some people, in terms of, I put these graphs here, these are, this is data actually from the actual vaccine trial. So this is data from the Pfizer vaccine in terms of people who say that the Black people weren't included in the trials. I show you data here, all of the racial breakdowns in terms of the people who were included in the data. And you can see this is where also we get the information that the vaccine is 95% effective. Again, this is data from Moderna. So you can see of all the people who didn't get the vaccine and the people who got the vaccine and how many of them actually got COVID during the trial. You can see that's also how we are able to determine that the vaccine is 95% effective. You can see there also Black people were included in this trial as well. And so right now we are not experimenting on people. This is this is a vaccine that has received emergency approval for use, and so that's why it's being used at the moment. So in terms of key messaging, we want to, like if shown you, the data is clear. COVID-19 is still with us, and we shouldn't take it lightly. As far as we know, the vaccines are safe and effective. 95% effective is as good as you will get. And also we would encourage people to take it. And for us in the county, the vaccines are actually free. So when you do need to get vaccinated, you are not going to be charged for that vaccine. We may ask for insurance for those who have insurance, but that is not to say that we are going to charge you for that. In terms of, just to reiterate, COVID-19 is still with us. Wearing a mask, that still works. So we know from data from the CDC that up to about 50% of the infections are actually are spread by people who are asymptomatic, people who don't have symptoms. In other words, if I don't know, so if I'm not wearing a mask and I just walk around, I may be somebody who is carrying the virus without symptoms, and I can spread it to other people. So wearing masks, washing hands, and keeping social distancing are still our best weapons to fight against this disease. Even if you've been vaccinated, by the way, you still need to wear your mask as well, because we don't know yet, if the vaccination prevents transmission of the disease. And I think I will stop there and let somebody else address some of those questions, and I'll take questions later on. Thank you.
Thank you very much, Dr. Nihal, for the PowerPoint, for talking about the statistics here in St. Louis and also in correlation nationwide. And thank you for unpacking some of the myth that people already have about the COVID vaccine and the coronavirus epidemic. So next, we were going to Dr. Melissa. My apologies, Dr. Melissa. At first, I rushed with your bio. Let me try to read it again so people can know who you are in case they intend to reach out to you in the future.
Just the important parts.
Dr. Melissa is an Athena Healthcare Chief Medical Officer. She earned her Bachelor's of Science from Yale University, Master of Public Health from Columbia University, and Medical Doctorate from Albert Einstein College of Medicine. She completed a residency at Washington University Burn Jewish Hospital. So Dr. Melissa, could you please discuss about the COVID testing at Athena Healthcare, as well as the task force recommendation on how to stop the spread of the coronavirus?
Thank you, and good evening, everybody. Thank you for having me. Happy to be here. I will tag team with the other presenters in that fighting COVID. Obviously, you've just seen the numbers. It is still here and with us. This pandemic is not over. And so we have several tools that we all need to use. So again, repeating the public health measures that we all need to keep doing, even if we are vaccinated or we get our chance to be vaccinated. And again, immunity after the vaccination is usually after the second dose, a couple weeks after the second dose. So continue to socially distance, wear your mask anytime you're around really someone outside of your household, especially if you're within 6 feet. And continue to wash your hands frequently, either with at least 60% alcohol rub or with soap and water at least 20 seconds. And in addition to that, another tool that we have is Covet testing. And Afinia, we did our first COVID test that was positive back in March in the office, and then started to do community events in early April. And we continue to do so and plan to do that. We have testing almost every day of the week at various locations through St. Louis City and County. Our Broadway location, our Biddle location just north of downtown, our Florissant location, Page, and then in Jennings. And then we also have a mobile unit that goes out to various hotspots and events on the weekends and during the week. And I will put our website in the chat. That's really the best way to stay up to date on where we're COVID testing. It's a PCR test. It takes several days to come back. Our Biddle location is now also partnering with the state. That's also a PCR test. But instead of hearing directly from Afinia, you hear from the state testing application called MACO. So that's been new for some folks, but we are happy for their support. So we've tested now roughly 26,000 people, and we're very proud of that. We want to bring free testing to all of our communities in need. And again, that's another tool so that we can combat COVID. And the final tool is the COVID vaccine, as we've been hearing about. Afinia Healthcare applied to be a vaccinator a while ago. We were approved just over a week ago. And by the middle of next week, we will have our first shipment. So we're super excited about that. We will begin vaccinating our patient-facing employees. So we're super excited about that as well. And then we will, again, as we have supply and are able to continue to get more vaccine from the state, we'll go through those distribution groups as presented earlier. So we're very thankful and grateful that we finally got some vaccine. We've been patiently trying to be patient, patiently waiting, maybe not so patiently some of the time. I will, and I will also say I'm an OBGYN, so I'll speak a little bit to pregnant women and breastfeeding and lactating women if you'll allow. There are very few groups that the vaccine is contraindicated for, such as if you have an allergy to any ingredients in the COVID-19 vaccine, or a severe allergy or anaphylaxis to other like intravenous or intramuscular medications. Otherwise, if you are immunocompromised, pregnant, or breastfeeding, your groups haven't been specifically studied in the trial. But I can tell you that for pregnant women, all of the items that we know about this vaccine would tell us that it is safe. So while pregnant women haven't been studied, they are a group that get the virus just like anyone else. They have the same risk for getting the virus, and they are at risk for getting sicker from the virus, just like they're at risk for getting sicker from the flu. So with that, if you're a pregnant woman, you need to have a few things in your mind to kind of go through your risk and benefits, right, of this vaccine. And in general, the benefit of getting the vaccine, especially if you're at risk for getting the virus, either due to your job or other factors because you care for someone who's at high risk or has exposure, then we would support you in that decision and encourage you to go ahead and get the COVID-19 vaccine. Same thing for breastfeeding and lactating women, not specifically studied, but we would be supportive of any woman getting the vaccine given the information that we have. Again, we encourage those conversations with your physicians and clinicians, but really that's a risk-benefit discussion to be weighed. And with that, I'll hand it over to the next speaker, being cognizant of time.
Thank you very much, Dr. Melissa. Our next question is for Dr. Mwangi. Dr. Mwangi, could you please share about COVID vaccine in the hospital, as well as the common misconception that people still hold about the virus and how it is transmitted?
Thank you so much for this opportunity. Thank you so much to the prior speakers. I think I'm following them. They have shared great information about the vaccine, about the testing and the statistics. For me, I think what I'm going to cover a little bit will be our experience in the hospital, and then I'll touch a little bit about the vaccine in the hospital. All of you are aware about the kind of the symptoms that a patient who get, or someone who get vaccine, COVID get. Most of the time is non-specific, like fever, shortness of breath, cough. Most of the time, and the cough is not productive. And most of the cases, they are very, very mild symptoms. And then they just went away. However, there are a group of patients whose symptoms persist and they need to go to the emergency room. And when they get to the emergency room, they are not just given fluid and Tylenol and sent home. Instead, they are told they need to be admitted. What are their experience when they come to the hospital? One, they are kept on probably some fluid because they are febrile and they are losing a lot of fluid, and therefore they are replaced with some fluid. The treatment for COVID in hospital has evolved greatly. We know from the very beginning, we started by just saying we can use hydroxychloroquine, we can use azithromycin, and then we changed from that because we realized that we are causing more harm than good. We started using plasma from other patients who have recovered from the same problem. And thereafter, we got a new medication, we call remdesivir, which we started giving to everybody. But we didn't just give this medication and walked away. We collected data and we reviewed how people are responding to it. And we have realized that not everybody who is actually benefiting from all this medication. And therefore, you may hear someone going to the hospital and instead of receiving any of these, they are told, oh, it's too late, you can get it. Like for the people that we take care of in the ICU, most of them are come to us at a very late stage or the disease is advanced. And therefore, even if you give them either plasma or you give them the remdesivir, for sure, it's not gonna do any good. And there are side effects and other risks that are associated with it. That said, there are so many other things that we do, of which most of them are sort of trying to support patients. But come mid-June, there was this study that came from Europe that showed that our old drug that has been used forever called dexamethasone, which is steroid, has been shown to have the most benefit on most patients. And right now, if you go to the hospital, I'm pretty sure you not leave there without a dose of steroid. We continue with the steroid during the hospitalization, regardless whether you have mild condition or you have a severe condition, for at least about 5 to 10 days, depending on how a patient is doing. That said, we still need a lot of people to volunteer in studies. So even when you come to the hospital and getting admitted, you will hear people saying that, oh, we want you to be enrolled in a study to help us understand this. If anything happened to that, or you hear someone in the hospital being told that, please encourage them to participate so that we can get more and more data. 2020 was a difficult year. It's the year that we all would like to forget. And it's one of the years that I have signed so many death certificates. There are people that I knew, people that I remember even now. And we are hoping that this year is gonna be a year of hope. And we don't like the trend that Dr. Nihao showed, whereby the cases are spiking, we are having more deaths. But we hope that as the time go and as we all start getting vaccinated, we're gonna get rid of this pandemic. For the interest of the time, I'm just gonna jump over to the vaccine. Why do we offer vaccine? I know for most of us who have come from Africa, vaccine is for the kids. If it's not for the kids, vaccine is for the pregnant women. But when you come over here, everybody is told you need to get this vaccine, you need to get the other vaccine, and you need to get the other vaccine. It's because this is a different world. When I see my patient and I want to talk to them about the vaccine, I usually ask them, what do you think vaccine does to you? And usually, this is how I approach it. I ask person, for us, majority of us in this call who come from Africa, they know that we have so many people who are long distance runners. We are well known worldwide for marathon. Those people who goes to compete, they don't wake up and go and compete. They have to be trained. And the vaccine, what they do is they train our body to recognize the actual virus or the bacteria when it invades our body. So when you get the virus, it's sort of like you are training for your marathon. So it's the same case with the COVID-19. When you get COVID-19 vaccine, you are priming your body that when the COVID comes, you will have enough soldiers to be able to overcome the threat, which is now the virus. There are different kinds of vaccines that are in development. There are some that have gone through the traditional way of development of the vaccine, like the one that recently talked about from Johnson & Johnson, that is developed in a traditional way, like the way the flu vaccine is produced. However, the one that our speakers talked about, that's the Moderna, as well as the one from the Pfizer. Those two vaccines are newer way. They have been developed in a newer way because they are using the genetics, or the genetic of the virus, and they are not using the whole virus. That's what I would like everybody to understand. They are not using the whole virus. They are using only a very small piece of the virus. And that particular piece of the virus is the one that is used to code or to direct the virus to produce the spikes that you see on the virus. The virus is usually loaded with smaller spikes. Those are the spikes the virus usually uses to invade into the human cell. So the gene that is usually involved in manufacturing of those spikes is the one that is in the COVID vaccines. So when you get the COVID vaccine, you are getting some protein that's gonna go into your cell and tell your cell you need to manufacture some protein that resemble those spikes. And then your body is gonna recognize those spikes and make, we call them antibodies. These are the cells that usually fight infection for you. So, and you're not getting a live virus, and therefore, once you get this protein enter into your cell releases those spikes. That is it. So the dose of the vaccine that you get is only programmed to work for a very short period of time, and then it wears off. It's not gonna hang around with you for a long period of time. Are you gonna have side effects from it? Yes. Why? Because you are making those proteins that are the protein from the virus, you're gonna react like you are having the infection. I got my 2 shots of COVID-19. I will share with you my experience in 1 minute. The first vaccine was like nothing. I didn't feel anything. I didn't even take Tylenol. And I walked and did my work as usual. Then after 3 weeks, I got my second shot. And the night after that, I woke up in the middle of the night and I had to look for a Tylenol because I was achy and I was having some low-grade fever. And then the following day, yeah, we had a little bit of symptom, but not significant that I didn't go to work. You know, I went to work knowing that what I have is not the viral infection. It's not the COVID infection. I have vaccine that is working for me to protect me for the future. As I said, 2020 was a difficult year when every day I would wake up and I know I'm working in ICU, and the first thing I'll do is I'll look in my list of patients, I'll see how many are new COVID. I used to be scared because I don't know if I'm gonna come with it home or in the next 3-4 days, I'm gonna be sick. However, right now, I feel a little bit confident that, yeah, I'm a little bit protected, although I don't know for sure whether I'm 100% protected, but at least I have some surety I do have my own soldiers. Therefore, we'll encourage every one of you to go ahead and follow directives from the previous speakers and sign up for the vaccine once it becomes available. I can see that our clock is tickling very quickly and there may be more questions that need to be answered. I'm gonna stop there and be ready for new questions. Thank you.
Thank you very much, Dr. Mwangi. And also thank you for sharing your story about your side effects from the vaccine. So now we are going to go into the question segment. So we've already received a few questions from the community. So I will ask this question to the panelists, and then after that we can get question from the chat. If you want us to ask your question, you can just type your question, or if you want to ask your question yourself, you can just type in "I have a question." Let's see. So the first question that we received from the community is, how long should one wait after testing positive for COVID before receiving the vaccine?
I can take that. Yeah, so once you get infected with the COVID, you survive, you develop your own antibodies. The studies have shown that different people, depending on their genetic makeup and everything, they produce antibody at a various amount or degree. However, we have seen that the level of those antibodies start waning off with the time. And a lot of people, even within 3 days, they even have no antibodies and they become at risk for getting infected. So right now, we are saying that if you have had COVID infection, you should at least wait about a month to 3 months to get the coronavirus vaccine. However, it may depend also with the direction from your doctor that you could probably be put at the end after everybody else have gotten it. But if you have had any COVID like symptoms, or you have had COVID, or you have had any other virus kind of infection, you should wait at least about 2 weeks before you get a COVID vaccine.
Right. Thank you very much for that. Our next question is it advisable to give the vaccine to children, and is there an age limit?
I can take that. So currently the 2 vaccines that are for emergency use are the Pfizer and Moderna, and they have not been tested in children. So for the Pfizer, it is 18 and older, and I believe Moderna is 16 and older. But again, there are now research studies enrolling children to look at how the vaccine will work in that population, how effective and how safe. But currently the vaccines are not for children. And secondly, I'll just share, as an OBGYN, I was able to get the vaccine given that I work in the hospital setting as well. And I had a very similar experience. So my first shot, I was sore in the arm. I purposefully did not take any Tylenol or ibuprofen because I kind of wanted to see the full effect so I could speak to that. And then I just received my second dose a couple days ago, and again, a little sore in the arm, but I am very thankful that I did not have any other side effects other than that.
Thank you. Thank you. Our next question is, what vaccine is Missouri using? And what is the projected timeline for everyone to be vaccinated in Missouri? By when? Is it by before January, before July, or is it towards the end of August? Or it just depends?
Talk to speak to that. So right now, I think the two vaccines that Missouri is using are the two vaccines that we already talked about, the Moderna and the Pfizer vaccine. Right now, timeline, I think it's anybody's guess, right? So the vaccines come from the federal government to the state, and then the states in turn sends them to the local jurisdictions. And so we don't know yet. So like for us, we've received some shipment of vaccines. We are vaccinating at the county health department of public health. We are vaccinating our patient-facing employees and other those in the 1A category. And then next week we'll receive, I don't know how many doses we'll receive. Next Tuesday we'll receive an additional shipment, and that will be dispersed as quickly as they come. So who knows? I think policy may change. We are hearing that, I think the new administration is trying to send at least most of the vaccines, send them to the states, and the state will then send them to where they need to go. So maybe that will change things or speed things up. At this point, I think as anybody's guess.
Okay, thank you very much. I believe we have one question from the attendants, Mohammed Abdi. He wanted to know when should we expect college students to get vaccinated?
How you're mute?
College students, sorry about that. I think college students, if you think of them as the people in that sort of healthy category, right? So unless they have, if there are people within, with some pre-existing conditions and all that, they'll fall in the different categories. Right now, let me see, where were we here? So if I go back to, higher education is like in that phase 2 range. So that's so there is phase 1, 1A, and then right now we are in 1A and 1B tier 1. We'll go to 1B tier 2 and tier 3, and then phase 2. That's where the other critical care infrastructure people are. And then you'll come to phase 2. That's where higher education faculty and all that are located. So I believe that's probably where they will fall. But if there are people with these at higher risk, people with all these pre-existing conditions and all that, obviously they'll fall in these different categories. I direct you again to the website that we provided here. It lists almost every conceivable category. Like in those categories, all of the groups that fall in each of the categories are listed. And so you can look in those which category you fall in.
All right, thank you very much, Dr. Nihal. We have a comment from Joshua, and after that, we're going to take one more question from the audience in order for us to respect everyone's time. So Joshua, do you mind stating your comment?
Yes, can you hear me? Yeah, let me first thank the panel for excellent information that we're able to pass to the community. I think mine is just for everyone, and also to the other workers, especially from being a migrant, because I think Dr. Neo talked about the myths about this the vaccine, and I think perhaps we need to explain about what is the messenger RNA. Because the biggest fears that I've seen through my WhatsApp is that it can modify the DNA, the genetic, which is as a biochemist, molecular biologist, I don't think that's possible. And we need to differentiate between we have HIV virus get integrated on our genome. So I think first I need to say that messenger RNA is just a molecule that is already existing in our bodies or in our cell. And basically, we are making, whether it's synthetic, we're just making a molecule that's messenger RNA, which, as Dr. Kaman said, causes a small piece of or a protein, and then we inject to the body and instruct the body to make that small fragment of the virus, and that will prime our immune system. So to our community, we need to know that actually messenger RNA is very unstable. So probably a few days or a few hours it'll be gone. So, and there's no way that the messenger RNA was going to be converted to double-stranded DNA. So but I think this information need to be put in a very layman language in our community, that they don't feel that it is something that has been developed to harm ourselves. But I think from biology's point of view, it should be safe. So let the other workers know that there's concern about the molecule, the messenger RNA, because not many people knows about the messenger RNA, but they know about the proteins. I think Dr. Mang will agree with me that when you talk about the messenger RNA, people will tell you about don't know about that, but they know about the protein. And I think you did a very good job trying to explain about the traditional way of making vaccines. That's making a protein, a fragment, and then doing the vaccination. But now this new genetic tool that we use, messenger RNA, now sort of scares people. But I think messenger RNA is cannot change, cannot be integrated in our DNA unless it's a big genome like HIV. Thanks.
Thank you very much, Dr. Joshua. So in respect of everyone's time, I think that is it. Thank you all for being here today, for joining us. And I will hand it over to Mr. Geoffrey to talk about the upcoming event that Vitina for Africa is having in the next few weeks.
Thank you so much. Thank you so much, Brian. I appreciate you for the good moderation. And also thank you so much for our great speakers. We appreciate you for that great information. But also thanking you all for who've been there with us. I'm sure the information you've gathered, you will be able to go and share to people out there. And especially those people who cannot be able to hear, to listen or speak English, I always count on you that you'll be able to share and talk to them. I know I applaud Dr. Mwangi. I was talking to one of the lady who was saying that she has been getting our information from Dr. Mwangi in the language that she can understand. So thank you so much. But I want to take this chance to appreciate and recognize some of the people that I see in the audience. I appreciate Dr. Kim and Dr. Alvin Gang. Are you there?
We are. Sorry, my husband.
Yeah, you want to say hi?
Hi, everyone. Thank you for the presentations. It was excellent and so informative. And this type of forum is so great, Jeffrey and Brian. Thank you for organizing it. I'm sorry, Elvin had to run and feed our daughter, but he would love to support in any way necessary. Thank you.
Good. Thank you so much. I know Dr. Alvin Gang has been doing a great job actually in Kenya, Uganda, and Zambia. So we definitely look forward to have a conversation with you both sometimes later. But also appreciating all the great work you do here in St. Louis, especially for the immigrant community. Thank you also, Dr. Christopher Gehring. Are you there? He's one of the newest board member. Thank you for joining us. And Alan, thank you so much. Alan is our board as chair by chair. And all those people have been with us. We appreciate you. I don't want to take a lot of your time, but I wanted to share a little bit invite you all for the event that we have next week. It's called Building Momentum Speaker Series.